Welcome to USTC360. I'm Ginger Chang. Today we revisit the city of León in Mexico, where Tzu Chi volunteers recently held the first free dental clinic there. Over the past 10 years, Mexico's healthcare system has been transforming towards universal coverage, which now covers at least 105 million Mexicans. To tell us more, we have Dr. Roger Tsai, the Deputy Director of Tzu Chi's International Medical Association Long Island chapter, and a physical therapist. Welcome, Dr. Tsai.
Thank you.
So what I understand, you've been on many medical missions similar to the one we will see shortly. And one of them, the first one was actually right after the 2010 earthquake in Haiti. So can you tell us what was it like to be part of the first clinic in Haiti?
Sure. I went to Haiti 1 month after the earthquake struck. A medical team before me, they set up the logistics. So I was actually in the first medical group that got to see patients over there. We all get to witness the devastation that Haitian people suffered firsthand. Also, we witnessed the magnitude of the mass destruction took place in Haiti from the earthquake. The whole experience left a very deep mark in my heart, and I'm sure all the volunteers who were there felt the same way.
Then while you were there, as a doctor, what philosophy did you apply to treat the patients there?
When I had the opportunity to go, all I was thinking was trying to do the most that I can to help patients over there. So we all brought suitcases, loads of tents, medicine, and also medical supplies, trying to help them as much as I can.
Well, we're going to move to the first segment. You brought up a very good point because while most people dread going to see the dentist, the local patients of León have found Tzu Chi's free dental outreach services to be patient-focused and heartwarming. Let's go follow our team members, Michael and Phil, who flew from Los Angeles to León.
The dentist didn't give him anesthesia. She drilled so deeply that even I could see the nerve, yet she still kept saying he doesn't need anesthesia, the nerve of the Mexican dentist.
Anesthesia and hypodermic needles both need to be imported, so the use of such dental materials is very expensive.
In Mexico, dentists aim not to help people, but to make money. This makes things very difficult.
León is the 6th largest city in Mexico and is known as the shoe capital of the world. The city produces products for both the domestic and international markets. Experts estimate that there might be anywhere from 3,000 to 4,000 factories within the city alone.
200 years ago, there were many Indians living in the area, and they primarily lived by raising livestock and cattle. Over time, more and more people arrived looking to buy the leather for hunting boots. Gradually, León became known as a shoe city.
There are currently 1.5 million people living in the city. 60% of the population find employment as a shoe factory worker.
The more specialized workers make around 3,000 pesos, while the basic workers only make about 800 pesos a week.
Blue-collar workers repeat mundane actions over and over again in the factory's assembly line. Factories are hard to work in since they are constantly very loud, as well as hard to breathe in, as the smell of superglue pollutes the air.
I earn approximately 5,000 pesos a month, which is a little above the average. But seeing a dentist is still too expensive for me.
I have seen local dentists before, and they usually either place my crown too high or too low. Sometimes they don't even fix it tightly enough so that the crown soon falls off the tooth. It would be a bigger priority for me to fix it, but each visit costs between 300 to 400 pesos.
The local dentists are taught the proper procedures in dental school, but often use hackneyed and improvised means in order to put the savings into their own pockets.
These practices are unfortunately very common in the Mexican dental clinics. But despite the cost-cutting efforts, such clinics still remain out of reach for the majority of the population. Most of the general public wait in line at a social benefit medical center operated by IMSS, which is the Mexico National Health Insurance System.
If I want to go to the social benefit medical center, I expect to wait a long time before I can see a doctor. There's a very long waiting list, and it is perfectly normal to have to wait 2 to 3 months before receiving attention.
When you need emergency care and can't access one, it's like the social benefit system doesn't exist.
My coworker went to the IMFF to receive treatment, but instead of getting better, his face became very swollen. Then he went to other public medical centers for help, but none of them would take his case since his affliction was very severe and they feared they would further endanger his life.
While the local social benefit medical centers were designed for goodwill and charity, they have actually gained a reputation as notorious as the Mexican drug war.
This is a special paper bag used to disinfect dental tools, but like all other dental equipment, it is very expensive, and it has to be imported. Proper hygiene practices will obviously increase the dental costs to the local doctors. So instead, they often rely on cheap rubbing alcohol to clean their tools, which they use to treat the next patient.
IMSS is the only choice for the poor. Personally, I dare not go because I'm afraid. I don't want to risk my life.
Hoping to improve the less than ethical medical practices, a lack of supplies, and the huge gaps in the dental education, Tzu Chi dentists from around the U.S. brought advanced medical equipment to Mexico for a free clinic. Along with 3 local Mexican dentists, they held the clinics in factories so that they could bring the services directly to the workers.
How they treat patients here is very different from how we treat patients in America. A local doctor told the patient she could go home with an open wound in her mouth. I told him he needed to stitch the wound.
This is a chance for a professional skills exchange.
Okay, Sierra. No, inside, by regular way.
The local dentists understand why our doctors take an extra step here and there to protect or avoid a mistake.
The local equipment is very outdated, so we brought some from the US and taught them how to use it.
update 的材料他们可能都没有用过，这样。交代病人，这个差不多半小时不能去咬这一边。好，让它高度。
Bien, pero dentro de media hora no tócalo.
This is a great opportunity for me to learn from the Tzu Chi doctors. Since they're so well trained, I'm excited to be able to learn so many new things from them.
说今天把底下这3颗蛀牙都补好了，3颗一起补好了。
Tres, ya te tapó tres.
Muy bien.
很好。
A gusto, gracias.
很高兴，谢谢。
We want them to be able to absorb as much as they can. If they can improve their bad habits and learn how to operate the new machinery, then they are able to become a better doctor. That is also the purpose of this dental outreach.
Power outages happen all the time. In Mexico, the infrastructure isn't very well developed. When you overload the system, all the electricity cuts from the power grid.
All kinds of incidents can happen when the clinic is held in a less than traditional venue like a factory. Dentists must cope with both the care of the patients as well as finding a way to make do in their less than ideal surroundings.
This is a light that is more commonly used by plumbers, yet we're using it in our dental outreach work. Although it isn't as bright as a traditional dental light, it is easier since we don't have to depend on an assistant to constantly adjust the light. This is definitely much easier.
The dentists also didn't have access to equipment like dental chairs. They did their best to look at patients reclining in massage chairs.
Dental chairs can be reclined all the way, but these massage chairs can only flatten slightly or stop at a 45-degree angle. Both angles hurt our back. In order to get into the best position, I am forced to prop up the back of the chair with my leg.
Without the proper dental chair apparatus, the dental team is constantly suffering from backaches. The dentists contort themselves into pain-relieving postures in order to continue seeing more patients. With the help of local doctors, the Tzu Chi U.S. medical team managed to help 233 patients in a 3-day span. More importantly, the dental outreach created the opportunity for more than just a professional skills exchange.
Claro que sí, es una forma en la cual
We should open our hearts so we can provide a better service to the patients.
abrimos nuestro corazón a ayudar a los necesitados.
Queremos invitar a otras personas.
I'll ask my coworkers to come help out. I hope we can have more Tzu Chi dental outreaches and serve more people.
Que puedan también dar servicio. No.
在这里，我们这一次的义诊活动里
This dental outreach serves a great purpose. Even though the venue isn't ideal for dental treatment, our medical team was still able to touch many people with its untiring efforts. They knew we gave our services and asked for nothing in return, so we hope that they will also be able to connect with the Tzu Chi family and become an inspiration to
其
others.
他的人间菩萨，或许作为一个提灯照路的人。
According to Mexico's National Institute for Public Health, despite the new health insurance policy, it still questions the adequacy and manageability of health facilities at the state and local level. In addition, other setbacks to Mexico's healthcare progress are the socioeconomic disparities and the poor sanitary living conditions. Dr. Tai, these are similar challenges Haiti faced. Can you tell us what it was like, the healthcare situation there?
After the earthquake, all the infrastructures are gone. So the hospitals are gone, the medical school is gone. So they don't have hardware over there. But similarly to Mexico, Haiti was very poor. The individuals are very poor, the government is very poor. So for those poor people, there's just no safety net. If you're very poor, you're just not getting any medical attention.
Then in situations like this, what can be done?
I think Haitian people need to make most use of their international relief funds and resources to rebuild their infrastructures, also to build up a safety net. And as far as TIMA goes, we continue to work very closely with them. US TIMA team maintains a good communication and offers training opportunities for the physicians over there. And they are also offered opportunity to go back to Taiwan to be trained for advanced medical trainings. And Tzu Chi is building schools, building clinics for them. Not only we are bringing our medical specialties to them, but we're also showing them Tzu Chi doctors' love and care.
Well, several of the local Mexican dentists and volunteers were very touched by our volunteer and doctors' commitment to helping their people. So let's go take a break and see their progress.
We were assigned to pick up the elderly from the slums in La Jolla for Buddha bathing food distribution. We woke up really early to go pick them up, but since the elderly needed to get ready before we arrived, we thought that many might have to skip breakfast. So we bought breakfast for them as well.
A vendor came to sell breakfast outside the bus, but after a long wait without much business, he left, having only sold 1 tamale and 2 cups of horchata. These volunteers all work in the shoe factories. They use the only day off during the week to serve local impoverished people.
It was very bumpy, but the atmosphere was still lively.
When people go to a new place, it's natural to feel a little nervous. So I try to play games to play with them so that they can relax and enjoy the trip a little more.
Entonces, lo que uno quería es socializar con las personas.
So shaky.
At the Buddha bathing ceremony venue, there are many people wearing the Tzu Chi volunteer vest. Not long ago, they were the service recipients at the dental outreach.
Many local Mexicans are deeply moved by Tzu Chi. I would say this is why many of them joined the effort.
We might be of different religions, but when it comes down to it, we are all about helping people.
The first time, we had 12 people, and then the second, third, fourth time, the number of Mexican volunteers grows to 48 people. These Mexican volunteers committed to coming back to helping out people in need with Tzu Chi.
豆，这也是米糖，这都是面条。我本来要给他们弄更多，但是太重。
今天这个是要给谁的？
山上的老菩萨。
After I volunteered for the very first time, I felt very happy that I was finally helping out my own people.
We brought some dental equipment that we plan to leave behind. Some of the supply, we can teach them what kind of supply can be used for this equipment and maintain it so that the breakdown chances are very slim and the equipment can last longer. Okay, see? All right. 这里是做工具，做打麻醉药啊，这种是补牙的东西。平常医生会讲 high speed， 就是这种 high speed， 叫他这手要手好来这样，你看啊 ，yeah， they'll come to me and say, the machine no water. Actually, all I have to do is check whether the bottle has been tightened or not. Sometimes they loose, that's why no pressure. Once you tighten, everything will fine. Those are things that you have to work on. Then only you know. If not, then they will take 1 year to figure out what happened, then tear everything apart, then figure out the wrong way. Yeah. Take 2, 1 hand each, okay? 一个手一个. The most common mistake that always happen is volunteer wearing a dirty glove and touch a clean instrument. Then the dentist use that instrument on the patient. Then the patient get infected because there's an easier way to get infection when you have your mouth open.
I didn't know until today that being a dental assistant meant paying such a close attention to detail. Tasks need to be done properly. It's definitely a big responsibility.
Because this is the most dangerous bacteria you have. There's all the blood, all this thing, and you might get the TB, TPs, a bucket, all the blood put in here. I've been doing this for more than about 11 years, but I started green in the field
But over the time, we learn from the experience and get this experience and transfer to the new volunteer so that next time when we have a clinic in Mexico, they will come out and help us. And that will be a great help for us that we don't need that many volunteers from US come to Mexico. So you guys have any questions?
I will do my best for those in need, but it's also very important to teach the local people how to fish rather than just always giving them fish. By doing so, they will be able to give outwardly instead of just merely accepting the aid of others.
When you perpetually receive help from others, you soon become accustomed to this treatment and might even become greedy. You might need help now, but you should gradually learn to return the favor. Only by initiating this process can you finally begin to rid poverty and become independent.
Welcome back. One thing I need to reiterate is that the team of doctors were very satisfied with the outcome of the overall training, because the goal is to give the local people the right tools so they can eventually operate independently in the community. Another reason the medical mission was a success was due partly to the great assistance of our translators. Speaking of language barriers, Dr. Tai, this was the case in Haiti. So how is it like communicating with the patients there?
It was very difficult in the beginning because most of us, we don't speak French or Creole. But we were very fortunate to have a group of college students. They're very talented. They speak Creole, they speak French, they speak Spanish, they speak English. Although their school is destroyed and they lost most of their classmates from the earthquake, they have no idea when they are going to be able to finish their college or even if they can finish their college. But they were very happy to help us, and we were very glad to help them, and we were very fortunate to have them.
Then, in this case, what can we do to improve this for future missions?
I think it all comes down to local people. In all relief missions, we try to inspire and recruit local people. We show them our love and care, and we hope to inspire them, for them to stand up and help their own people.
Well, I have to say what you're doing, along with the team of doctors, you guys are doing a great job. You guys are giving the people the reason to believe again, especially after all the traumatic experience they've been through. So thank you very much for being here.
Thank you very much for having me.
And folks, I hope you enjoyed today's feature presentation. I'm Ginger Chang, and I'll see you next week.